People who are investigating surgery are interested in the names of the procedures, but very often they don't know exactly what we do when we do surgery or what the effects are of the procedures themselves. I think the best way to look at the procedures is to think physiologically. Of course, I'm a surgeon, I deal with 3D articles, I deal with organs all the time, and I think in that regard. But I think it's very helpful. And I have a scale model of a stomach that is much smaller than a normal human stomach would be. But for the purposes that we're going to use it, I think it's very helpful. And if you look at the stomach, this is the food pipe called the esophagus, where food comes down into the stomach, it reaches into the body of the stomach, and then it goes out through the bottom of the stomach and into the small intestine. What we do during the course of gastric band surgery is we do not alter this relationship. We do not alter the esophagus or the stomach or the small intestine. What we do is we take a tubular structure that's like a belt, very much like the belt that you put around your waist when you get dressed in the morning. And we stick it in through small tubular holes called ports in the abdomen, and it comes in a single strand like this. And we take that belt and we carefully dissect the tissue around the upper part of the stomach, not on the esophagus, but on the upper part of the stomach. And we thread that belt around that upper part of the stomach. And then there's a buckle, just like a buckle on your pants. And we thread, using long instruments, the tubing through that buckle, and then we pull it in and we cinch it down. And just like the belt around your waist, it cinches and it locks, and it becomes tight around the wasted upper part of the stomach. We then take the tubing and we thread it through your abdominal wall and attach it to the portacath, which sits underneath your skin on your abdominal wall, approximately in your mid-abdomen, basically under where my pocket is. We don't put fluid in the band at the time that we put it on because we want food to be able to pass down and pass through. Later on, when it becomes time where we want to adjust the band, we will place a needle through the port on the skin. That fluid will go through the tubing to the band itself and will blow up the balloon on the inside of the belt and will tighten the band. How tight does that band have to be? Depends on how it fits when it's put on. This band fits quite snugly. Some bands fit much looser. It's kind of like a wedding ring. Some rings fit very tight, some rings are a little bit looser, and sometimes during periods of the month they're looser and sometimes they're tighter. But basically, the band is supposed to exert subtle pressure on the stomach from the outside in, and when food comes through the esophagus, the food tube, and empties into the stomach, it stimulates the stomach wall, which sends responses back to your spinal cord, which sends responses up to your brain that makes you feel satisfied more quickly with a smaller amount of food. It does work to a certain degree like a toll booth, where the food comes down at a very fast pace. It slows because it meets the toll booth, but then it goes down and into the stomach and it becomes digested and it gets released into the small intestine and goes downstream. This does not alter your anatomy internally. You can take a pill and it can go from your mouth right down and through and out through the rear end like any normal pill would. It's a mechanical device and we have to put it in place. If it doesn't work out well, the nice thing is we can go back in there, open up the buckle, unthread the band, and take it out through the small little holes we use, and it's gone, leaving your stomach behind. There is a little bit of scar tissue on the outside of the stomach, but that remodels very quickly, and if you go back and you look at that stomach several weeks later, it looks like there was never anything there at all.